Can I ask everybody to please go on mute? Thank you. Hi, everyone. Thank you for joining today's session on breastfeeding and lactation. We have Ramyaa with us, who is going to be talking about breastfeeding and lactation. And Ramyaa is an expert in the field of lactation. I'm going to hand over to Ramyaa so she can introduce herself and then we can get started.
Yeah, thank you, Rishu. Thank you so much. Thank you, Newspert, for this opportunity. So I'm an international board certified lactation consultant. So first of all, I'm a mother of a toddler, a 4.5-year-old boy. So it all started with my motherhood. So being a new mom and having difficulty with my own breastfeeding experience. So that brought me into the field of healthcare from technology. So being a peer-to-peer support in terms of lactation, from there the journey started. I became a lactation care counselor, and then I qualified myself as a international board certified lactation consultant. And I also specialize in pregnancy and postpartum fitness and yoga. So we do conduct a lot of sessions in the name of Mommy Talks Wellness Hub. So we have a small hub wherein we educate and we conduct sessions, classes. We do consultation on right from pregnancy to parenting, including child nutrition as such. Yeah, so this is about me.
Thank you so much, Ramyaa. It's an absolute pleasure to have you. For those of you who do not know us at Newspert, I'm Rishu. I will be moderating the session for today. I'm the co-founder and CEO for Tillid and Newspert. Our objective is basically to support all parents in the key moments of their parenting journey, because parenting should be enjoyable and it should be as stress-free as possible, because once the little one comes, you already have a lot on your plate. So yeah, so we are going to kickstart. May I please request
on top you have
a couple of people who are not on mute to go on mute, please. Right. So thanks, Ramyaa, for giving us the time. We'll get started. And, you know, my first question to you is, in India, a lot of families believe that the first milk of the mother is not good for the baby. Is that really true?
Okay. So human milk is the first food, which is very unique and it is specially tailored for the needs of the human infant. So colostrum, the first milk is very, very, it's the safest food in this entire universe, in this entire world. So it's not like it's not good. It is definitely loaded with so many ingredients, and it is specifically designed to protect the infant. More than the nutritional aspect, the first important aspect, the primary function of the colostrum is the protective one. The secondary is to provide nutrition. Why? Because initially babies, first of all, colostrum contains approximately 5 million cells per ml. It's very, very small in quantity. So on an average, the first few days are from the 16 weeks of gestation, from the pregnancy period, the colostrum is there in the mother's breast, and it contains a lot of live cells. It contains a lot of immune properties, lot of vitamin A, microbiome. See, breast milk is not a sterile liquid. So following birth, the bacteria in the breast milk helps the infant's gut to, establish this beneficial bacteria, and which will protect from the dangerous bacteria, and it is very much easily digestible. It is considered as a laxative, where it helps the baby pass meconium. So there are a lot of growth factors. Newborn's gut is very much permeable. There are gaps in between. The cells have gap. And so these growth factors are highly concentrated in colostrum, and it promotes the gut closure. Okay, it's mainly for infants' protection. Okay, the protective factors are more, and it is not something to be discarded. It is a very, very, very precious golden, liquid gold, I would say. Yeah.
Wow. I didn't know about that. So, there are a lot of first-time moms who do not necessarily get the milk in the
Mhm.
first few days.
Yeah.
And is that something which is a problem? Is that something that is going to impact the baby in a negative way?
Yeah, that's right. So, lot of mothers see, the first reason why there is a delay in the milk production is the first few days. A lot of mothers don't get milk. Is something that is we think that it's very natural. It can happen after a few days. It can get delayed, but the first reason why it gets delayed is because of the interventions during birth.
Right.
That is the primary reason. And if at all, and there are other factors as well which can cause the delayed milk production, like for example a c-section, or if the mother is having any kind of medical conditions like diabetes, type 1 diabetes, or if the labor was if labor was too long, if there was too much of fluid overload during labor, if the mother is obese in general, if the mother has some kind of hormonal issues. So there are a lot of reasons why this can happen. But other than this, if at all the birth had less interventions, if the baby was given immediately, the baby was put immediately skin to skin with the mother, and if the breastfeeding was initiated within the first hour, then the chances are that the milk will come in exactly, the nature's intended timeline will actually work. It's not that it will get delayed. So if at all the interventions are less, if we can support in that process where we can reduce the number of interventions, if the baby is given immediately to the mother, if the mother initiates immediately, then that will help. So it's not that there will always be a delay. One thing that can help in cases where I mentioned, if there are chances of, if there are any conditions, if we know that there are chances that milk will get delayed, then we advise that during the antenatal period, after 36, 37 weeks, okay, mothers can express their colostrum because it's going to be there from 16 weeks. Okay,
Right.
so that is really a good option where we see a lot of mothers coming in to birth their baby who are bringing in the colostrum obtained during this antenatal period. So they express the milk with hand expression, and this colostrum is frozen, and they bring it in syringes or storage, however. So this was also considered to be safe by the DAME study. And so this is such a cool thing where we can avoid unnecessary supplementation to the infant. This is only for specific conditions where we already know that the mother might have a delay in milk production. Like I said, if the mother is having any kind of gestational diabetes or something like that.
But when you say interventions, Ramya, does it mean that anybody who goes for, say, a lot of people these days prefer C-section, right? Because they don't want to go through the normal delivery process. And does it mean that anyone who opts in for C-section is likely to have problems with the first milk?
First milk, yeah. So there are chances. It's not that every case, but of course, like you said, C-section, cesarean birth itself is identified as one of the maternal condition where that can cause a delay in the onset of full milk production. Okay. So that can be a red flag. Yeah.
And interventions also include, say, when you have forceps baby.
Exactly. Any kind of interventions, like even with respect to the medications that has been given during the process of birthing, the IV fluids, there are so many interventions that can happen, like you said, forceps or vacuum birthing, and if the induction itself, okay, with the induce the labor. If the labor is not initiating on its own, they induce the labor. So a lot of drugs can also intervene, a lot of procedures can also intervene, and because of all these things, because there's a lot of hormonal play going on, and that can lead to a delayed initiation, delayed onset of milk production. However, colostrum is still there from 16 weeks. So in specific cases where the mother can support the baby with colostrum, they can express antenatal.
Right. That's very interesting. I did not know anything about the interventions. And I mean, of course, I was going to go for a preferred C-section, but my delivery was a little strange. I was in for a planned cesarean, and 10 days before my daughter decided to come the normal way. So I did not have
Wow.
a cesarean. I landed up having a normal delivery. But yes, it is quite interesting in terms of how the human body behaves. Is there
Exactly,
anything that
like
the
you said.
mothers? Sorry,
Sorry.
go on. Go on.
Yeah, like you said, nature has its own timeline. So the baby knows, your body knows when exactly to birth the baby, and nobody needs to, tell the mother how to birth. The mother knows by instinct. So when the timeline is crossed or timeline is in advance, and when there are interventions popping in, when like inducing the pain or giving, augmenting the pain, augmenting the labor, or since that the deadline has crossed, it's 40 weeks. So on the day of deadline, we have to induce, we have to bring the baby out. So a lot of things like this are interventions which actually cause, because the baby is not ready, the mother is not ready. When the body is not ready, obviously their hormones will take its own time. Yeah.
Yeah. Yeah, and I think, like you said, there's a lot that can be done from a preparedness perspective as well. But perhaps there's just so much that is available on internet these days that parents don't
Mhm.
really get the real picture in terms of, what is the right thing to do.
True.
So
That's
is
right.
there any exercises that mothers can do in the antenatal stage where,
Mm.
the breastfeeding perhaps can become easier, or maybe the lactation process? Is there something that they can do to support the lactation process?
Yeah. So first thing is to not do anything. Yeah.
Okay.
Why? Because see, antenatal stimulation of breast can cause unnecessary issues. Okay, like we've been told, there's a myth that you'll have to keep stimulating your breast, you have to keep pulling your breast during the antenatal period. Only then your breast will be, your nipple will be erect, your nipple will be, the length of the nipple will improve. Only then your breastfeeding will go good. But unnecessary stimulation can lead to some kind of effect, wherein there are chances of, in terms of high risk pregnancies, there are chances of preterm labor. It can induce contractions. So the best thing is to not do anything with respect to your breast. Okay, you just you can just leave it, and nature has its own timeline. And if at all, what you can do is, how can you support the process during antenatal? You can get aware of everything. Okay, breastfeeding education about during the antenatal period. So how to, what can we expect? So how much important the colostrum is, how can I inform the support system, or can I take an informed decision? Can I discuss with healthcare provider regarding my delayed cord clamping, regarding immediate skin to skin, immediate initiation of breastfeeding, no matter what kind of birthing, even if it's a C-section or if it's a vaginal birthing? Can the baby be on skin to skin? Can the breastfeeding be initiated? And can my support system, help me in terms of positioning the baby? So when the baby is born, what should I be looking for? How should I position? How should I have the attachment? What should I look for when the baby is attached at my breast? How to establish a very good attachment or a deep latch? Okay, because everybody is concerned about latch. So how should the baby's body and my body be aligned? When should I seek support? If at all colostrum is not coming, if at all baby is not able to suckle, what should I do? How can I hand express? Okay, if at all milk is not coming in for the first 2 to 3 days, what should I do? How many times should I express? So all these things you can learn in advance. A good antenatal breastfeeding class will give you all kind of information. Google gives you information. Internet is loaded with information, but everything is not scientific evidence based. Sometimes it's really, really overwhelming. So going to a proper, healthcare provider or a lactation professional and attending a good antenatal class will definitely help. So with respect to breast stimulation, you should not be doing anything, and keeping yourself aware is very important.
Right. You mentioned a point about, the child is not able to suckle. And I think
Yeah.
there are a lot of cases where some of the babies have like tongue ties. How is it that parents can identify? I don't know if the health professionals do the checkup and tell the parents, but is there a way that parents can identify that there is an issue with suckling because the child has got a tongue tie? And is there, any reason why kids have tongue tie?
Okay, so the reason for tongue tie is not really, a conclusive one, because some of the studies suggest that it is genetic. And some of the so the reason is that, say, how do we identify a tongue tie? What is a tongue tie? First of all, it's just that the frenum. Okay, everybody will have a frenulum, the tongue. You'll have a small tissue where you'll there will be an attachment base of the tongue to the and the floor. So this, when this frenulum, everybody will have a frenulum. When this frenulum is tight or short or thick, and if it is not allowing the movement of the tongue properly, okay, the tongue should move in all possible directions. Should lateral movement should be there, it should go up the palate, it should come down, and it should go like through all parts of the tongue should be able to move. And especially in breastfeeding, tongue plays a major role, because tongue is something that that draws the milk, and the infant is able to draw the milk with the help of the tongue. And if that is not, if the movement is restricted, if that restricts the movement of the tongue, this thick or tight or short frenulum, then that is a tongue tie. So during the embryogenesis, when the baby is in the womb, this frenulum, it just goes off. The apoptosis of this frenulum happens. If that doesn't happen and that frenulum is still there, if it's very tight or if it is very thick, then that causes. So primarily it's because of the genetic, I would say. My son had a tongue tie. So with my experience as a parent, not from a professional point, as a parent, I would say breastfeeding really impacts, because of the tongue tie. Okay, not for all, but breastfeeding is one area where the tongue tie can impact. Okay, so why? Because tongue is really essential for a proper breastfeeding. And so my son had a tongue tie, and we had this difficulty with latching. He was not at all able to suckle. He was not, more than suckling, I would say, he was not able to effectively transfer the milk. Okay, because babe, even though you have a tongue tie, our bodies tend to compensate. So where in the cases where you have a tongue tie but breastfeeding is going smooth, okay, there are cases like that where the breastfeeding is really going smooth. So what happens there is the babies tend to compensate using other body parts, especially the neck, shoulder, and full body, to adjust so that they have to thrive. The baby has to thrive. Okay, so this will happen. So how can we support with tongue ties? That you need a proper assessment. Okay, the assessment is not based on the appearance, it is based on the function. Okay, just mere existence of the tight frenum is not an issue. Just the tongue tie itself doesn't call to snip off. Okay, how it is impacting the function? Is the baby able to move the tongue in all possible ways? If it's not happening, then how it's impacting in the breastfeeding? What can we do? How can we support? And is there any tightness, stiffness in baby's body? So it's a holistic approach wherein you get involved with a lactation professional, a pediatric dentist or an ENT, a body work or body worker, preferably a craniosacral therapist, or some kind of a pediatric physiotherapist or an occupational therapist who can help with the movement of the tongue with some exercises. Sometimes baby might need massage, sometimes baby might need some kind of additional support. So it's a complete teamwork. So being aware that the function of the tongue, when it gets impacted, it will affect the whole body, not just the breastfeeding. And it doesn't stop with breastfeeding alone. There are chances that the tongue tie can impact speech, can impact sleep, can impact the oral motor skills, can impact the development of the jaws, and the way that your the jaw should always be it should be broad and forward. But if there is an alteration, it changes. The chances of crooked teeth, all these things comes when the tongue is not doing its work properly. So there are a lot to it in terms of breathing and sleeping and everything, which is a whole different concept. And for this to come in the textbooks, it might take again another 10 years because it's something new and people are not aware of it. So being aware is very important. Yeah.
But like you said, the assessment and everything that needs to be done is, I mean, for parents, right? So for a person who is just delivered, how does the mom or the father identify that there's a tongue tie? Is it just that, when we see that the child is having issues taking the milk, or you go to a health professional, or are there any tips that you can give to the parents?
Correct. So like you said, so immediately when you see that, when you sense that the baby is not able to latch onto the breast, when the baby is not able to suckle properly, or if the latch is not deep, if the baby is not taking mouthful of breast and drawing close to the nipple, how much ever the parent tries, the baby is not taking mouthful of breast and baby is taking only the nipple. So if these things happen, if the baby has some kind of difficulties in sustaining the latch, if the mother is having a painful nursing, if the shape of the nipple is changing, and if there are so many other factors, but what you can immediately, as a newborn, as a new parents, what you can observe is, if there is anything with respect to latch, if the baby is not able to suckle properly, if there is any pain, immediately go and check with a lactation professional or any healthcare provider who can assist you with proper breastfeeding position alignment. So first is to check this, and then is to do an oral assessment. The healthcare provider should do an oral assessment where it is not based on the appearance, it's based on the function. If at all they see that the function is impacted because of the tie, then accordingly we'll have to divert. Yeah.
Sure. Is tongue tie usually painful for the child?
I wouldn't say it's usually painful, because some babies compensate. Okay, but it is difficult for the baby to for an optimal function, to thrive in an optimal way. Okay,
Yeah, because I had read somewhere that babies don't feel pain for the first couple of months. The senses for feeling pain comes in only much later.
Yeah, so it's as such not painful. It is definitely painful for the mother, that I would say. Okay, in most cases it would be painful for the mother. Where the baby is compensating and the baby is taking only the nipple, obviously if the tongue is not moving, the nipple gets, the abrasion happens, and the mother will have a painful nursing experience. But for the baby, it's difficult for the baby to transfer the milk effectively. That's it. It's not about pain. It's just that baby is putting in so much of effort to thrive.
Right. Thanks,
So
Ramyaa.
the full energy is going to be used by this portion alone, wherein the baby has to, the other development, other milestones has to achieve. The brain development is going to be peak. So if the entire energy is concentrated only on sucking and swallowing and transferring, then everything else is getting compensated. So that is the reason.
Right. So we all know that breastfeeding is not easy, right? I mean, once you've delivered, you're already going through the process of recovery, and then you've got baby blues that accompany. So we all know that breastfeeding is not easy, and the frequency at which you have to feed the baby, that takes a toll as well. So are there any tips, strategies that you would give to new moms, and especially our audience? I'm assuming most of them are new moms or expecting moms, in terms of how they can make their lives easy during breastfeeding.
All right, so that's right. So first, as I said, a good antenatal preparation, being aware of what to expect when the newborn comes. Okay, in terms of knowing that how much colostrum will my body make. So on an average, in the first 2 days per feed, the baby will be able to requires only 2 to 7 ml, somewhere between 2 to 7 ml. That much exactly is required. So and how much is what is the stomach size of the baby? How much milk does the baby require when the baby is 1 week old or 1 month old? So knowing this is very important. And then what can make this process easy is immediate initiation of breastfeeding. Okay, no matter what kind of birthing, you can inform the healthcare provider. Immediate initiation of breastfeeding and immediate skin to skin, staying with the baby in close contact, that will really help. And then frequent and effective removal of milk. Even though there are cases where the baby is not able to remove the milk, you will have to massage your breast and stimulate your breast and remove the milk effectively. So in the first 2 to 3 days, if you focus on skin to skin, plenty of skin to skin, and frequent and effective removal of milk, either through direct breastfeeding or through expression, then that itself is a very good check mark where 90% of the breastfeeding issue is sought. Okay, you will not have a low milk supply at all, if at all you're putting efforts in the first 2 to 3 days. Okay, so breastfeeding, like you said, it's not easy. So how can we tackle this from a nutritional perspective, from psychological perspective, from physiological perspective. From physiological perspective, like I said, stimulation is the key. Frequent and effective removal of milk. From psychological perspective, how you bond with the baby, how you connect with the baby, giving plenty of skin to skin, sleeping with the baby, sharing the bed with the baby. All these things are important, and trusting your body, trusting the baby. That is very much important. And with respect to nutrition, yes, of course, there are a lot of foods which are natural galactogags, which can help you staying well hydrated and eating as per your hunger. That itself is the big key. And there are certain natural galactogags which we use in there are traditional culture specific foods that will also help in terms of maintaining the lactation, or in terms of making the breastfeeding easy.
Is there anything that the fathers can do to help the moms in the breastfeeding process? Like, to ensure that the mother gets adequate sleep as well. Otherwise, to be honest, you're literally 24/7 just breastfeeding.
Definitely. There is a lot that the fathers can, fathers play an important role. Not just the father, the entire support system, especially the fathers. They can connect with the baby through skin to skin. Okay, the mother is there to feed the baby. What will the father do? So fathers also have kind of depression. Fathers also will feel let out. Okay, what am I doing? What is my significance in this part? How can I father the baby? Okay, so they can pitch in, they can give skin to skin, they can bond with the baby in terms of massaging, in terms of helping the baby with respect to bathing, changing the diaper, changing the dress, all these things, giving the mother good rest, making sure that mother's mental health is okay, making sure mother is well fed, is the mother well hydrated, giving the mother healthy snacks then and there, just checking in with the mother. Okay, are you feeling okay? Do you need any help? Okay, and fathers, definitely they will be able to identify a lot of breastfeeding issues, okay, more than the mothers, because mothers sometimes will be taken away with those hormones and everything. They somehow want things to work, but fathers will be able to, okay, this is what is happening, and they are the first person to reach out to a healthcare professional. Okay, she is suffering, this is what is happening. So you can help in terms of, first of all, being a part of the team with respect. So getting yourself prepared from antenatal, you can get yourself prepared so that you will know what to do, when to seek support. Yeah, and always keeping the mother at peace, making sure the mother is getting rest. Sometimes the fathers can come, they can just
sorry, Ramyaa, I think you went on mute. I've lost you.
Can you hear me?
Can't hear you.
I'm not on mute.
Yes. Yeah, can hear you now.
Yeah, all right. So fathers can give mothers a good massage, that will improve the oxytocin, that will improve the letdown, that will make them feel loved. Oxytocin is just a love hormone. So a foot massage, or giving the baby a massage, taking care of the mother. Sometimes it's just as simple as telling the mother, some kind of comedy or something, making the mother laugh, something like that. So allowing the mother to just go for a walk and come, taking the mother outside to get some fresh air. Okay, something like this. So in each and every part, the father can pitch in and help the mother.
And I think they can also help by giving the expressed milk to the baby, right? So because the mother's already expressed the milk, so perhaps the fathers can take turns to, give certain feeds as well.
Yeah. If at all breastfeeding is not going well, so that there comes an important role. If at all there is a need that mother has to express the milk and the baby should be fed expressed milk, then the father can learn how to do the cup feeding. Okay, then the father can feed the baby with the help of a cup or spoon, or sometimes it is not advisable to go with bottles, but with respect to giving mother a break, fathers can definitely learn all these things and handle the baby. Most of the fathers do not even know to handle the baby. They are afraid to even lift the baby. So you can get familiarized with all these things and try to bond with the baby. And like you said, giving express milk, everything. Yeah.
Right. So a couple of questions that are coming up. I did have a few others, but perhaps, in benefit of time, let's just take the questions that have come up.
Mm.
In terms of the first question that has come up is, how do you detect a potential delay in lactation? Is there a way you could detect a delay in future?
Okay. So when the colostrum is not in place immediately after birthing, when you're not getting colostrum, okay, what you do is you can try to hand express. If you are expressing with your hand, if you're massaging your breast, if you're expressing with hand, then with continuous stimulation, your milk will start coming in. If for the first 2 days, if there is no colostrum, then that means there is a delay. So that's a clear indication that you can just wait for the first 6 hours, and immediately after that you can start massaging and you can start stimulating your breast. We can remove the colostrum with hand expression. And like I said, some of the factors like which can cause delayed initiation: interventions during birth, IV fluids during the birth, C-section, the birthing, this medications, and then the cases where the mother is having a medical condition like diabetes, type 1 diabetes, type 2 diabetes, gestational diabetes, any kind of hormone, thyroid or PCOS, something like that. If the mother is obese or overweight, so a lot of conditions like this can also be handled, knowing that there can be a delay. Yeah.
Right. So we'll move on to the next one, Ramya. What can husbands do to help with lactation journey and process? I think this is something which we have broadly covered. So unless there's any other questions, please put it in. But we have already covered what the fathers can do. Is there a course on antenatal lactation on Newspert? We don't have a course yet, but we are in the process of putting something in. In the meanwhile, if you want to book in consultations with Ramya, you can do that directly from our website. For a newborn, how frequent and how much time we must feed? I think it's
Okay.
how many times should we feed a newborn?
Yeah. So for a newborn, it is always from the newborn stage, it is always on-demand feeding, wherein we identify the hunger cues, early hunger cues of the baby, and we immediately bring the baby to breast. So always baby decides when to feed, how long to feed. So number of times it depends on the baby, but till the baby regains birth weight, usually the baby will drop a considerable amount of weight, say maybe up to 6 to 5 to 7% on an average. If it goes beyond 10%, then that needs immediate immediate support. So if so till the babies usually take or roughly around 1 to 2 weeks to regain the birth weight. So till then it is in general preferred to feed the baby as often as 2 hours once. Okay, if the baby is really sleepy, then you can just lift the baby, remove the baby's dress, and you can bring the baby skin to skin so that the baby is, so frequent and effective removal of milk is important. And on an average, newborns, they feed at least 10 to 12 times a day in the first 1 month. Okay, aiming for 10 to 12 feeds is good. Some babies take less number of feeds, say 6 to 8 feeds. So it depends on the babies. But if the baby is really sleepy, if the baby is not suckling, if the baby is not coming to the breast, then it means at least 10 to 12 times you'll have to stimulate your breast, you'll have to feed the baby. Yeah. And always the duration of the feed, the baby decides.
Okay. So I think it's ideally like about 2 to 2.5 hours, every 2 to 2.5 hours when the baby is taking milk, right?
Yeah. So that cannot be exactly timed, because we always suggest do not read the clock, but please do read baby's signals, baby's hunger cues. Some babies take feeds in less than half an hour, 1 hour. So I think one mother had asked about cluster feeding. So what is cluster feeding? They tend to, feed very frequently. And this happens during the time of growth spurts and mental leaps, which usually happens in the first 1 month, in 4 weeks, 6 weeks, 3 months, 6 months. There are times wherein few days to even a week, babies tend to cluster feed, especially in the evenings and nights, where the feedings can go for a very long period and within a very short frequency. So this can also happen. So whenever the baby is showing hunger cues, if everything else is going well, then just latch on. That's it. So you'll have to make sure that everything else is in place. So there's no actual exact time, 2.5 hours, 3 hours. Maximum time that you can wait is 4.5 hours also. Some babies might take, as long as baby is gaining weight, baby is well fed, baby's urine and motion, everything is going good, then that's a clear indication that baby is getting enough milk.
Right. So there's another one which is on tongue tie, which has been covered. So we'll move on to the next question, which is, are we able to increase milk at 3 months?
Yes. At any point you can increase. So there is a possibility of induced lactation. So when induced lactation, relactation is possible, wherein even people who have not gone through the process of pregnancy can, can put in effort and can be supported with respect to bringing in the lactation. Definitely at 3 months or 6 months or even 9 months, you can definitely increase milk supply.
Okay.
With proper support with a lactation professional. That is important.
Thank you. So the next one is, could you please explain about cluster feeding? When and how often does it occur?
I think we just covered that.
Just covered that, yes. The next one is, do flat nipples usually interfere with breastfeeding?
As such, no. As of now, 95 to 99% flat nipples don't interfere with breastfeeding, because it's always breastfeeding and not nipple feeding. Okay. So nipple, if the attachment is deep, if the attachment is good, nipple goes deep into the baby's mouth. So during the initial period, in the first few days or a week, yes, of course, it can be little tricky, but with proper support and with proper, adjusting the position, I would say that how you hold the breast, how you shape the breast, all these things comes in handy with respect to making the baby latch well. During the first few days, it can be tricky, but 99% flat nipples don't interfere with breastfeeding.
Okay. I think there are some other questions which we have briefly touched on, like, growth spurts, where you did mention about cluster feeding. And then there's another one on breast massage, where you said that it is not required. You don't interfere during the antenatal phases.
Exactly.
I think the one that's perhaps...
Unless it is indicated, that is very important. Unless indicated, please do not express in advance. During the 9th month, definitely no. Yeah.
Okay. The next one is in hand expression. One of the participants is saying that they're not getting more than 10 ml. Does it mean I have no milk? It's been 3 months, but my baby only gained 1.3 kgs from his birth weight.
Okay. So one thing is that the amount of milk that you express or pump is not an indication of your supply. It's not a reliable way to measure your supply. Okay, it's what you're able to pump out or express out. It's not what is in there. Okay, that is important. And if at all, so seems like the weight gain is not really adequate, 1.3 kg from the birth weight, but do not know what was the lowest birth weight of the baby. But however, baby seems to be gaining, and if at all there needs to be any support, that please do contact a lactation professional, or you can reach through NewsPert. You can reach me through NewsPert. I'll definitely be able to support. With proper history and complete assessment, we can guide you better.
Thanks, Ramya. So the last question that's there is when to seek lactation consultation.
Yes. So when to seek lactation? So first thing is, if you are a pregnant mother, or if you know someone who is pregnant, the first thing is you can seek help of a lactation professional to get to know about everything that you can expect during the postpartum period. Okay. And so knowing everything, so book a antenatal class for breastfeeding, that will help you. So that is one thing. And when the baby is born, If the baby is, like I said, if the baby is not able to suckle directly from the breast, no matter how much ever you tried during the first 2 or 3 days, if the baby is not at all coming to the breast, if you need support with respect to expression of milk, if you need to know how, in what interval should I express, how can I better express my milk, what routine should I follow, all these things. If at all you are having any painful nursing experience, then if at all the baby is rejecting the breast, and if at all you're having any kind of sore nipple or cracked nipple, if there is any kind of engorgement or fullness or heaviness in your breast, if you're facing any fever or pain, and so all these things in the initial few days to look out, so that you will have to immediately reach out to seek support. Okay.
I think we have broadly covered. Sorry, go on.
And one important thing, please do observe the baby's feeding pattern. Please do observe baby's urine and poop output. If at all there is something that is missing in there, then immediately that's a clear indication. Especially the first 6 weeks, more than urine, baby's poop is the reliable indicator to know whether baby is getting enough or not. So if there is something missing, if the baby is not passing stools adequately, if the baby seems to be constipated, all these things, if at all you feel full and you're not able to express milk, if you feel your breasts are very even in the first 1 week, if your breasts are not full, so there is a requirement that you will have to seek for lactation support.
Thanks, Ramya. It's quite useful because I know when my daughter was born, we were told that is she pooping enough? Is she having wet diapers? That's an indication whether she is doing all right. So we were told that you should have about 8 to 10 diapers, wet diapers a day, and at least 1 poop a day. So till the time she is having a poop and wet diapers, everything is fine. You don't need to worry.
Yeah, and sometimes parents miss out. Some babies might be, urinating very frequently, 15, 20 times, but the poop will not come. Okay, so that means there is something wrong. Okay, so we'll have to identify all those things. So if the baby is not able to empty the breast completely, baby might be able to take only the initial 4 milk and baby will be urinating well, but whereas the poop will not come. So there baby might be doing frequent feeding. Baby might be, urinating well, but the weight gain will be low. Okay, so all these things are an indication. Yeah.
Thanks, Ramya. It was all very useful. I realize as the conversation goes on, it's a very broad topic, and given that we're not having enough time, in the last minute, can you just quickly tell us a bit about, we all know the power of human milk, the mother's milk, but unfortunately not everybody can, breastfeed, and people do move to formula. So do you want to tell us a little bit about the pros and cons? Is it that formula is not good, and should the moms feel guilty about it that they're not able to breastfeed?
Okay. Yeah. See, one important thing is I would always say whether breast is best or not. Okay. Being informed is best. Okay.
Right.
I will not even come into the category of fed is best, breast is best. Being informed, being aware, and being supported is best. Okay. No matter your feeding choice, whether you want to breastfeed, whether you want to formula feed, are you supported in your feeding journey? Okay, it's always the mother feeding and not just the breastfeeding. Let's not even focus only on breast milk or breastfeed. It's the mother feeding. So when it comes to mother feeding, the mother chooses whether it's breast milk or formula. And always, feeding the baby with love is more important than what you feed. Are you connecting with the baby? Are you able to bond with the baby? That is more important. Of course, there are a lot of cons with respect to formula. Formula does not have so many immune properties. Formula does not have so many digestive properties. Formula does not have so many things with which aids, optimal brain development, function, everything. So there are a lot of things. Every drop of breast milk has more than 5 million live cells, which no other food in this world has. That is the power of breast milk. We all know that. But still, given the situation, no matter what, every mother is doing the best for the baby. Yeah. Whether it's formula feeding or breastfeeding, no matter what. So give a lot of skin to skin, and mothering is more important than narrowing it down to what you're feeding. Okay, so it's feed the baby with love and be supported. Every mother requires support. So being supported is what is very important, I feel.
Absolutely great note to end on, Ramya. This was really insightful. I think what you said is absolutely right. The mothers need to be supported. And I think there's just a lot of societal pressure that comes into play when you're talking about breastfeeding.
Yeah.
Unfortunately, we are out of time now. So for our audience, thank you so much for joining. If you have any questions, please feel free to write to support@newspert.com, and we will be able to organize sessions with Ramya. We can also help you organize consultations with Ramya. And thank you so much, Ramya, for this very insightful session. My daughter is 2 years old, but a lot that you told today is something which I wasn't aware of. So, a little late, but I suppose it would come handy at some point.
Definitely. Better late than never.
That's right. Thank you so much. And it was
Thank you
lovely
so
having
much.
you all on the session. Thanks, Ramya.
Thank you so much. Thank you, everybody, for participating.